Yeah, good evening. Yeah, good evening. When we are doing the last 13 questions, we can get an idea about each paragraph. Then we can do the first 7 questions quickly. Oh, my poor little girl, Dr. Kalai Shelby. I'm very sad. Okay. When you do the first 7 questions, you'll get the idea of all the other questions. It is the opposite way, actually. Okay. No problem. No problem. I'm going to teach you now. I'm going to teach you now. Because these are the questions that you will get the answer in 7 seconds. 7 seconds, not 7 minutes, 7 seconds. 7 questions in 7 seconds you'll get. That means you'll get double the time for the remaining questions. These are easy questions. Easy, dead easy questions. That's what we are going to see now. Yes. You can invite your friends today. Yes. This is Grand Master class. And on behalf of Grand Master class, I, Peter Simon, give you all a warm welcome. For all the students who are watching either on the Zoom or in the YouTube, wherever you are watching, Grand Masterclass is pleased with you and is happy to provide you different learning experiences. This is a reading complete demonstration session. At Practice with Peter. This session is open for one and all. Grand Masterclass, learning platform for serious students. fractures, dislocations, and sprains. Fractures, dislocations, and sprains. Reading part A. First we'll deal with reading part A, then we'll go for reading part B, and lastly we'll go for reading part C. You have heard it right. We are going to do the complete reading session. Do not miss this session. If you have planned for a wonderful sleep or slumber, postpone it to tomorrow because today we are rocking. And you know I mean what I say. This is not a joke. Fractures, dislocations, and sprains. Okay. Now I'm taking you to the text. Yeah. I'm taking you to the texts. It's so simple here. Do whatever you want. I don't want you to read anything, but just I'm giving you what a chance for you. Read whatever you want. It's not useful, but still you want to read, you read. Okay? You can still read. This is text A. I'm giving you 2 minutes to read only text A. Do whatever you want. But we are not going to do anything with those things, but still you can read. Now we are moving to text B. Let's go through this. Part C. Text C. Then we have some more information is here at the bottom. Then we have text D. That is text D. So that is all about the text. Fine. I told you, you know that when I tell you something, I mean it. I'll try to give you the best possible options. I'm taking you to Telegram channel now. This OET reading part A. Live lecture zooming online. Texts, fractures, dislocations, and sprains. This is regarding text A. This is regarding text B. This is text B2. This is B1. I have broken into three parts. B1 split into three parts. And this is B2. Because it's a big passage, I have split into three parts. Yeah. This is B3. So three parts I have shown you now. This is C. This is C. And this is D. So we have all the four things here. Okay, we have all the 4 texts here. That's very clear now. Now I'll take you back to a new slide. Yes. I have to show you a bigger font. So reading part A. Live lecture, zooming online, fractures, dislocations, and sprains. Fractures, dislocations, and sprains. Now, before moving on to this one, listen.
So here there are 2 specific booklets. One is the answer booklet, question answer booklet or question booklet, and the second one is the text booklet. So now we are bothered about text booklet. In the text booklet you have 4 texts: text A, text B, text C, and text D. Now these 4 different texts talk about 4 different components. They don't have any relation with one another. So text A talks about something, text B talks about something else, text C talks about something which these 2, text A and text B, doesn't talk about. Okay, and text D will talk about something else. So here, that is what is the difference. Now what are you supposed to do here? First, study the title. It is talking about fractures, dislocations, and sprains. That's all. And underline these words. Fractures means break. Dislocation means change the position. Sprain means not fractured, not dislocated, but there is a pain, sprain, some difficulty. So these are the 3 different levels. First one is sprain, is related to muscle. Dislocation is related to position. Fracture is related to bone. You should understand the difference. Fracture is related to bones. Dislocation is related to location, change in position. Sprain is related to muscle. So this is what it is you have to understand. So you have to study. You have to understand what it is talking about. If you don't understand the title, you cannot understand anything else.
Now, you, at the end of the session, you can answer without reading anything. You don't need to read anything. Those tricks I'm going to tell you now. You are not supposed to read anything. So, see, I'm going to take this an extra shot. Yeah. Yes. Yeah. So we have this now. These are the text. I have got it in different angles so that you can see bigger size. Okay. Actually, this lecture was taken November 9. November 9. Okay. Not this now. Yes, here it is. February 2, 2021, 2.5 years before. This lecture was taken. Yeah. February 2, 2021. Okay. You can see here, February 2, 2021. Right. So, why am I giving you all these things now? So, this is fractures, dislocations, and sprains. Don't read anything. Do not read anything. Do not read anything. Without reading, you're going to get the answers. Without reading anything, you're going to get the answers. So, fractures, dislocations, and sprains. Right. Now, this is text A. To see bigger, if we want to find the answers. Actually, for 1 to 7 questions, we don't need this also. We don't need this also. We don't need anything. Just we can write. And you are going to see that. You are going to see that. Yeah. So fractures, dislocation, and sprain, they are categories or types. There are 3 categories. One is fractures, one is dislocation, and one is type. So 3 types of things. Now I'm going to show you that one. We don't have anything here in the text, but we have to identify that one. So when you come here, I'm going to show you here, nothing is there. Fractures, dislocations, and sprains. This is the title. Read this title. Text A is about fractures, dislocations, and sprains. Text B is about fractures, dislocations, and sprains. Text C, text D, everything, the entire, all the 4 texts, the entire 2 pages. Okay. Text is fractures, dislocations, and sprains. Okay, fine. Now coming to the point, now let's go to text A. Fractures. Keep the notes ready. because I'm going to tell you topmost secrets. Fractures, dislocations, and sprain. Yeah, anyone who is dare enough to talk about the difficulties in part A. Now there will be 2 episodes, before Simon Sir and after Simon Sir. Okay, before Simon Sir's classes and after Simon Sir's classes, what is the difference? Okay, many people are new here. So anybody who has courage enough to tell you about your difficulties. Now Kalai shall be told, sir, I will write the 7 questions in the last. Why? Because these 13 questions will help me to understand the first 7 questions. That is what she was telling. And many people, even Avil, who has come all the way from Mangalore to Trivandrum, okay, after talking to me on the very second day, he booked his train and he came, bus and came here. He's next to me now, okay. So he's in intensive training practice. So he also said the same thing, sir. I'll do these first questions last, sir. I told why. The question answer was weird. I did not understand what this is. So, Kalai, do you have the courage enough to speak? Whatever you do, whatever difficulty you are facing. Okay, now I'm going to start. This is the first reading lecture for you. So, you can unmute and yeah, you can speak if you can, or anybody else who wants, just raise your hand and I'll give you. What is the strategy that you are following? Because I'm going to tell you a totally different strategy, completely different strategy. If anybody is interested, you can type your name or you can raise your hand so that I'll give you the mic, because we are going into the topic. No one. Okay, fine. So now no problem. Now let us see here. Fractures, dislocations, and sprain. Fractures is the serious one, intense problem. Dislocation is the moderate problem, and sprain is a simple problem. Sprain is just a muscle sprain. Then dislocation, bone moves from one place to another place. When you fall down, 3 chances, 3 different types of problem. The most serious problem is the bone will break. There will be a slit or a break or something, and it's unbearable pain. You cannot manage it normally. You have to do something seriously so that it will stick onto the place. Okay, fracture. The next one is dislocation. Dislocation. Now from here to here nothing happens, but here happens some problem, or here. So wherever it is connected with another bone, there is a problem. Bone doesn't have a problem. Fractures means a particular bone has a problem. From here to here in middle, anywhere problem is there. But dislocation, there is no problem here and here. The problem is at the 2 ends. Dislocation will come off, or dislocation will come off, or something. Dislocation. Okay. The joint is out. The ball and socket joint is separate. So that is called dislocation. That means instead of being here, it will come this side, like this or something like a bender. It comes, it twists out. And the ball which is in the socket will be, ball comes out. Okay. And again, with great difficulty, it has to be put inside, and there should be some adjustment so that it will not come. Once it comes out, again, anytime it may come out because it has become loose. So that is called dislocation. Dislocation of the ball and socket joint. Next one is the sprain. Sprain is not related to the center of the bone or from top to bottom or from the ends also, but sprain is about the superficial, above. It may be bruising, muscle, skin, blood vessels, all these things. So you have some sprain. Okay. So try to understand this particular 3 different types of problem. So now I will give you one word here. The word number 1 is here. Yeah. I'll give you different words, synonyms. So you have to learn all this. Otherwise, there is no question for you. You're going to suffer. You're going to suffer otherwise. First one, these are called the types. Types. Or you can call it kinds. Types, kinds, categories, groups, classes, divisions. Come on, give your names, please. Give your subtitles. Anything you can write, type. Okay. Yeah. When we are doing the last 13 questions, we can get an idea about each paragraphs. Not each paragraph, each paragraph. Then we can do the first 7 questions quickly. Sorry, that's the wrong strategy. Totally wrong strategy. You will tell after what. I will not tell. You will only tell Kale. Yeah, classification. Somebody has given classification. Yes, Rajeshwari. Very good. Yeah, classification is yet another word. Classification. Okay. Come on, any other word you want to tell? Types, kinds, categories, groups, classes, divisions. Okay, classifications, right? Or departments. What else? Any other name you can give? Types, kinds, categories, varieties, varieties. 3 varieties of problem. Types, varieties, different synonyms. These are very important because there you will listen, there you will read in the text. Okay, fine. So these are some examples. Types, kinds, categories, groups, classes, divisions, classification, departments, varieties. Okay. Yeah, many more. These are enough for us now. So this is number 1. So types or kinds or categories, any one word you will take. Now next one here. Now here you see immediate management. Immediate management. Management. Immediate management. That means before you go to the hospital, before you get into the ambulance, immediately when you fall down, immediately something is done on the spot. When some accident happens and something happens to you, then immediately how you are going to manage? You can manage only simple fractures, not. So this is about fractures, and that too simple fractures. This is about simple fractures, management of simple fractures. See here, immediate management of simple fractures. So this is management. Management. Okay, simple management. Next one is clinical assessment. That means after going to the clinic, the doctor will assess. After going to the clinic, the doctor will assess. Don't read all the 2 pages. It's nonsense. Read these things. That's enough. You are not reading, you are studying. You are not reading, you are studying. Remember that. You are studying. Fine. Next. So after this one, you can see here. There are some other words also here you can see. Okay. Some other words also you can see. Now let us see here. Observation, examination. Okay. Observation, examination, examine. Okay. This is physical examination. After going to the clinic, doctor will do all these things, physical examination. Then there is another word called check. Checking means examination. Okay. The next one is management. Management. So, first immediate management, immediately you do whatever is possible from your side. Then you take to the clinic, then doctor will assess the condition. After examining, then doctor will manage the condition. Okay. Then doctor will manage the condition. So try to understand this point here. Next. So that is B. So here, this is simple management. You can say simple problem. First one is types of problem. Second one is simple management. Management of simple problems. So this is management. This is management of what? Simple problems. So this is simple management. You can see. This is simple management or ordinary management. Ordinary management or simple management. Because simple fractures, so simple management. Serious fractures, serious management. So why is he telling simple fracture of limbs? Why is he telling simple fracture of limbs? That means he has grouped in two parts. Fractures, he is categorized into two parts. That means if you say all the boys come to the left side, that means you understand something. Read between the reading between the reading between the lines. Now, anybody can tell me. If you can, if you can write, you can write. Otherwise, if you can type, you can type. Whatever you want. Okay. Now I am telling you, this is our hall. All the boys come to the left side. All the boys move to the left side. That means all the boys will move to the left side. Is there anything else in that? Can you infer anything else from that? I'm talking logic. Anybody? Anybody? Come on. If you can speak, raise your hand. I'll open your mic. If you feel hesitation, then type there. Now, what do you think about this one? What extra information you got? All the boys come to the left side. This is a classroom. Yes, Srija. Girls stay back in the or move to the right side. All the boys come to the left side. That means all the girls come to the right side. No need to tell. That's understood. That is understood. Now, for example, if I say, now this is a mobile. Here is a screw. Here is a screw. Or these are my glasses. These are my glasses. Here is a screw. Here is a screw. Okay. Here is one screw and here is one screw. Now what happened? I called my assistant. Okay. I called my assistant and I told him, this screw is loose. This screw is loose. And I told her, and I gave these glasses to him. Now, if you are my assistant, what you will do? I told this screw is loose. Okay. And I gave the specs to him. That means what you are supposed to do. Can you open your mic and speak? Or can you chat in the? Yes, I will tighten it. How? If you can do it, you can. Otherwise, you can take to the showroom and they can get it done. You have to fix it. You have to tighten it. Okay. And something is loose. Now, for example, I went to the shop and there is a shopkeeper, there is a salesman. and I'm buying shirts. I'm buying shirts. Okay. I'm going to buy shirts. Then what happens? I'm talking logic, because you don't apply these logic things. That's why you are suffering. No more suffering. No more suffering. Now here, I tell the salesman, I went into he said, sir, try this shirt. He said, sir, try this shirt, and he gave me this shirt. Now what I did, I went into the changing room and I put it on. I left my shirt there only. Or I removed the shirt and I put my shirt on and I brought to him. The salesman is there. And I handed it over to the salesman and I said, this shirt is loose. Not loose. 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 Not lose. Loose. 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 Not z. Okay. Now, if you are in the salesman's position, now what you will do? Now this shirt size is 44. The size he gave me is 44. And I am telling this is loose. That means what will he do? Yeah, Rajeshwari says, give smaller than that. A size, 1 or 2 numbers, smaller than that. Now, for example, if I say this shirt is tight, he gave me its size 28. And I said, this is tight. This is tight. Then what he will do, if you are in the position of the salesman or a saleswoman, what will you do? He gave me for 28. And I said, this is tight. Now what are you supposed to do here? Yes, give a little bigger size. That means 30. Yeah, that is my size. 30 is my size. So this is called reading between the lines. Somebody type there, reading between the lines. The meaning is implied meaning. For example, your father comes and tells you, you are not studying properly. That means what? You have to study properly. That's it. Reading between the lines means you are only reading the lines. You are just reading the lines. You are just reading the lines. From beginning to the ending, you are writing. Why are you reading all these things? Are you crazy to read from the line number 1 to the line number last? Are you crazy to read all these lines? You are reading all these lines because you think that there are many things in the lines, but there are many things between the lines. So that is the technique you have to follow. You have to read between the lines. Something is there hidden between the lines. That you have to extract. You have to extract those things. Right. Now, you got the point now. That point you are going to apply here. If you see here, simple fracture of limbs. That means limbs, fracture. And now simple fracture of limbs. Why is he telling simple? That means there is something not simple. What is the word for not simple? Can anybody tell? Can anybody type? Not simple. One word substitute for not simple. Come on. Activate your brain cells. My dear Rajeshwari, my dear little girl, major is the opposite of minor. Serious is the opposite of ordinary. Compound is a different. Simple, come on. Complex, yes, that's right. Srija and Avil, you're right. Redmi, who is this Redmi? Computers are also learning English? Wow. What a great impact. Simon Sir's class is wonderful. Not only human beings, computers are also learning. Yeah, who is this Redmi? My dear, please, can I have your name if you don't mind? I'm sorry. Yeah. Name, please. Your first name and second name. Please. Yeah. Come on. And thank you. So, Amruta T. Very good. Thank you, Amruta. I know a great person by the name Amruta. Mata Amrutanandamayi. Correct? Yeah. Very great name. I don't know the pros and cons, but I know that it's a very great name. So, first, second, yeah. Rename Amruta. Okay. T, I think she has written. Yeah. So, Amruta T. Yeah. My memory is working properly. Right. So if this is simple management, that part A, text A is about categories, text B is about simple management. That means simple management. That means there is complex management. There is complex management. So simple, write down words. Simple. What are the things here? Synonyms. What are the synonyms? So this is management. Management which is simple. Simple fractures. Now, simple, what are the synonyms of simple? Simple, common, ordinary, general, usual, normal. I'll give you a number of words like this. Okay, normal, regular, okay, simple, common, ordinary, general, usual, normal, regular. Okay, so these words you can use. Any other words? Yeah, casual. Yeah, of course. That's a great word. Yeah, casual. If you know any other word, you can use here. Simiyat. Very good. All the students who are on this platform, if you listen to me obediently till the end of the session, you can get at least 40 out of 42. Yes, you can even get 42 out of 42, 500 score. You can, but listen to me, 100%. Unwavering faith put on me, my words. Yeah. Casual, usual, regular, common, normal. Okay. This is it. Right. Yeah, minor. That's also right. Yeah. So, if this is management, okay. Now, if this is management, which is simple, common, ordinary, general, usual, normal, regular, casual, minor, A is not related to this. That means a C or a D may be the opposite of this. If I'm talking young people, that means I'm considering the age, young and old. If I'm saying all the ladies, that means I'm talking about gender, ladies and gentlemen. If I'm saying all the boys, that means boys and girls. So automatically that should come into your mind. So if this is simple, common, ordinary, general, usual, normal, regular, casual, minor, then that means C or D. Why he gave that point? That means he has broken it, he has split into two parts. Management is of two types. One is ordinary management and then is extraordinary management. Simple management or special management. Common management or uncommon management. Ordinary or special management. General or particular management, usual or unusual management, normal or abnormal management, regular or irregular management, casual or official management, high level management, minor or major. So like this, you'll get these words. So either C or D will be related to this. Okay, fine. Now we are moving to C. Now C is talking about what? Now let us see. C is talking about drug and therapy protocol. Drug therapy protocol. If you see there, you can see many places. Here it is drug. Here it is drug. Try to understand that. Here drug, here drug. And morphine is a drug. Morphine is also drug. Okay. That's very clear. Morphine is a drug. That's very clear. See that. Next one. Dose means drug. Dose means drug. Naloxone is drug. Naloxone is drug. So try to understand all these things. This is about drug. What are the other words for drug now? Drug, therapy, medication. Drug, therapy, medication. Okay. And analgesia. Drug, therapy, medication, analgesia. Then tablets. Then what else? What else do you relate this one? Drugs, therapy, medication, analgesia, tablets. Tablets, injection, all these are related to that only. Injection. So these are some things. Yeah, fine. These are some things which you can see. Now A is types, kinds, categories. So categories. B is management simple. B is management simple. So C or D should be management complex. And C, we know that it is not management complex, it's drugs, therapy, medication, treatment. Okay, now that's it. So this is done. That means D is the opposite of that. This is also management, but it is opposite of that one. You can understand here now. Management, it's not simple management, it is complex management. It is uncommon management for uncommon problem. It is extraordinary management because the problem is extraordinary. Okay. General. So here specific. Opposites I am giving you. Remember these things. These are very important. You have to learn. Okay. If you learn only, it will be easy, not just attending a session and going off. Okay, learn. Then you'll find out answers without reading the passage. I'm not showing you to read the passage here. We are not going to read anything here. No question of reading for the 30 questions, 20 questions. No need to read at all. I don't know why people read everything. Okay. And they say we don't have time. When you don't have time, how can you read all these things? Even if you read, do you remember anything at the end of it? Normal, abnormal, usual, unusual, regular, irregular. Irregular means not regular. Okay, casual. Okay, casual, you can say official. Casual treatment for casual problems. Official treatment for official problems means high level. Minor, it is major. Major treatment for major problems. So this is how you. So this is how you are going to assess. Now I think you understood the subtitles. Have you understood the subtitles, all of you? Have you understood the subtitles? This is the secret. This is the secret. This is the secret. Come on, come on, come on, respond fast. Okay. Okay, how many students are there? Let us see. Avil, Kalai, Kiran, Matsepo, then Jyotsna Jayan, yes, Rajeshwari, Rajya Lakshmi, Riya, Simyat, Srija, Sukhvinder, Vinita, these are all regular students. Don't miss the session, please. A very important session. Very, very important. And we have Shakar. And we have Amruta, two guests. Welcome to the platform. These are all registered regular students. Don't miss the session today. It's very special. And these sessions will come only once in 2 months. So don't miss the session, please. Right. So these are the 4 words. Now, what I'm going to do is I'm going to close these things. Close. So first one is categories or types. Second one is management simple. Management simple. Okay. Okay, we had to go to that one. Sorry, I forgot to remind you. So this management complex management is plaster back slab. So this is plaster back slab. Plaster back slab for fractures. Okay. Arm fractures and leg fractures. Plaster back slab, that is the complex treatment for complex fractures. That is uncommon treatment for uncommon fractures. That is extraordinary treatment for extraordinary fractures. That is a specific treatment for specific problems. This is an unusual treatment for unusual problems. Out of 100 fractures, only 1 will be broken. That's unusual fracture. Maybe 2-3% only will get serious fractures. For them, plaster back slab is abnormal. That means not normal. So abnormal treatment for abnormal problems. Irregular treatment. This is not regular treatment. This irregular treatment. Not rarely happen. Rarely. Common, rare. Uncommon. Okay. Rarely this treatment happens. Plaster back slab is a rare treatment. For all the fractures, if you give it's common treatment. Common, rare. Rare. It's opposite of common. Uncommon also. Uncommon means is equal to rare. Okay. This is a rare treatment. Another word you got now. Rare. Okay. Rare. So like this you'll get, I did not remember that time, but now I got it. So you'll work, ponder deep, dig deep, you'll get diamonds. So rare treatment for rare problem. Okay. So major treatment for major problem. That's it. So B and D are contrasting. B and D are contrasting. In the same way, child, if they say somebody, child, dosage for child, that means when he says child, that means children. Children below 18 years of age. That means he is dividing it into 2 groups based on age. Below 18 and above. Below 18, child, and above 18, adult. So if child is there, definitely adult will be there. If ladies are there, definitely gentleman will be there. If simple is there, then complex will be there. So try to understand. This is how paragraphs will be segregated. So remember that. So plaster back slab, plaster back slab. So plaster of Paris, plaster. Okay, plaster. So it will be repeated too many times. That is your heading, remember. Which is repeated 2 or 3 times, that is called the subtitle. It may be in the beginning. If they don't give, then it will be repeated. So plaster back slab, plaster. Okay, plaster back slab. Can you see that? Repeated. That's it. Okay, that's the secret. The word that is repeated is the subtitle. Fine. Now, yeah, management 2, management 3. 3 parts I gave because big paragraph, no? So I split into 3 parts. Then this is drugs, and this is the same thing. Okay, so that you can see very clearly original format. And this is text D, plaster backslash. Yeah, that's it. Now, so categories, A is related to categories. That's very clear. A is related to categories, means types or groups, 3 different groups or 3 different varieties of problems, types, 3 different kinds of problems. Then next one is management, simple management. Management means ordinary management other than serious. That is B. C is drugs. D is plaster. So try to understand this point here. A categories, B management, C drugs, D plaster. So you got 4 words. 4 words. A categories, B management, C drugs, D plaster. Write these 4 words in your notebook. Now, write these 4 words in your notebook, and these should be on your mind. These should be on your mind. When I ask you, then type the answer. When I ask you, type the answer so that it will go into your mind. Text C, type your answer. Text C, type your answer. Text C. Text C, type your answer. 10, 9, 8, 5, 4, 3, 2, 1. Yeah, stop. Next, text A. Now text A. Text A, what is the title? Any title you can give, anything, whatever you want. It should be in your mind. My title will be types, your title will be categories, his title will be something. No problem. Your answer is yours. You create your own title. Nah? Who is bothered? We want answers. I want to go to Delhi. Whether I go by flight, I go by train, I go by bus. I will come by bus. I cannot go by bus. I'm an old man, no, so I take a flight and go off because I cannot travel 2 days. How many hours? 18 hours. 18 hours I cannot travel because I'm an old man, and many people will be waiting for me. Simon sir's class, they will be waiting for me. Okay, I cannot spoil their time. Time is very precious for me. So within 3 hours I'll go there. Half an hour journey from Bangalore to Trivandrum. Half an hour flight I'll take. It's not the point of money here. It's the point of time. So I have money and I don't have time. So I use flight. He has money, but he wants money to study. So he doesn't want to waste. No problem. If I go a little late, what is the problem? I have a lot of time. I will go to Simon sir and I'll sit there for 2 months and I'll clear my OET and come. I have a lot of time, no problem. One day late if I go, what is the problem? I can stay even 1 week later. So he has a lot of time. So he took the bus and came. That's it. That and this almost the same price nowadays. AC, sleeper, bus, almost the same money. That's it. So try to understand this. Your means is different, but goal is the same. Write down means and goals. Means and goals. Very, very important words. All these words are very important. They will come in the sessions. Means and goals. What do you mean by means? What do you mean by goals? Okay. Now, you are here in India and you want to go to UK. India is here, UK is here. You have different means to reach there. You have different means to reach there. You can go by flight. You can go by train. You can go by boat. Okay. Anyway, you can go. Or you can go in your own car. So that is called means. The things which will take you to your destination is called the means. And the destination is your goal. The destination is your goal, right? Now your goal is cracking OET and your means is maybe YouTube, maybe Grandmaster class, maybe some other private teacher, okay, maybe self-study. Means may be different. That's it. So you can take any word you want. Don't think that Simon sir has taken types means I should also take types. No. You create your own style. Okay. You create your own style. That's it. Yeah. Goals. Write down the words. Goals, targets, write in the notebook. Goals, targets, all others write in the chat box. Write in your notebook, wherever you want. But at least somebody, 1 or 2 persons write in the chat box so that everyone will know. Goals, targets, aims, objectives, ambitions, results, consequences, destinations, aims, objectives, goals, targets, aims, destinations, results, outcomes, consequences. Okay. Output, result. Fine. Next one, means. Means. The second one is which take you to the goals are means, methods, techniques, strategies, ways, manner, modes, ways, methods, techniques, tricks, manners, modes, route, way, path. So these are all means. Okay. Right. Okay. Now, next, making you mind because you will give fast answers now. Fast answers you will give now. Okay. This is amazing. Who is this? SR Srija Ravindra? Yeah. Okay. So, text. Now you will be thinking, sir will tell B or what? Okay. My wish, whatever I want to give. Be ready for anything. Text. Yeah. D. Text D. Plaster. Common. Yeah, plaster only. Everyone write plaster. Or special. Or specific. Or extraordinary. Management. Anything, any word you can use. Major problems. Yeah. Any word you can use. There is no problem. There is no problem. Because I am an expert, I am bringing in a correct word. But for you, you don't need correct. Who is bothered about the words? You don't want the answers. That's all. Leave them. For me, I need the exact word because I have to explain you. Because I'm a teacher, I have to give you the perfect example. You can create your own word, anything. Okay. Yeah. Next one. Next. May give you a twist. A over C D over D over. Again. Text C. Come on. Immediately your mind should be ready. Yes, that's it. Yes. Medicate. Yes, good, good, good. I'm telling you, I'll ask any question anytime. Your answer should come. Your answer should come just like that. Gunshot. Huh? Which one I will give, I don't know. Which word I will give, I don't know. You should be ready for that. Yes. Next text B. Text B. So this is what it is. When I ask a question, immediately you have to give the answer. And how many will answer? But be careful if you don't imagine, if you don't get the answer readily. Take your time. No need to just blindly push the answer. Okay? Don't immediately you need not give. At least take 1, 2, 3 seconds. Think about the answer. Just don't blindly give some answer. That's what it is. Are you ready now? Are you ready, or should we try for somewhat, rehearsals? If you are ready, we'll move forward. Otherwise, some more rehearsals we can take. One more round I'll give you. Okay. Now I'll give you another style. Now you should say A, B, C, D. I will tell you the word. Okay, one letter only you should type. I'll see. Come on. I'll give any word, my wish. Because in the question, any word will be there. Yeah, because this is how I will teach this like this, but you should learn the second way around. Yeah. Think a little and answer. I can give any word I want. Yes. Number one. Question number one. Suppose it is. Yes. 3, 2, 1. Done. Come on. A, B, C, D. Any one word you can write. Any one letter. Any one letter. Yeah, come on. We don't have much time. This is how I'm giving you. I'm training you. I'm training you. People don't have time to learn all these things. Leave them. We're not bothered. Next, number 2. 7, 6, 5, 4, 3, 2, 1. Here we go. Hospital. Think. Hospital. Number 3. Number 3. Bandage. You are going, those who are answering all these answers, responding, you will get 20 out of 20. Don't worry. You don't know what we are going to do. Number 4. Science. I'm giving you 20 questions. If these answers, whatever answers you are giving right, then your 20 answers will be right. You know what is right and what is wrong. I need not tell you answer. I need not tell you answer. Next, fifth one. Immediate action. Immediate action. On the spot action. On the spot action. Number 6. Serious issues. Number 7. Dosage. Number 7. Dosage. Number 8. Majority of the answers are right, then you are right. Otherwise, if you comply with the majority, you are right. If your answer is separate, that means you are wrong. Okay. Out of 15 students, of 10 students are giving the right same answer, means that is right. Okay. The next one, eighth one. Distinguish. 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 That's it. You're doing well. Distinguish means identify which is what. Whether it is a distinguish, whether it is a sprain or a dislocation or a fracture, you have to distinguish. Means identify. Okay. And next, okay. So that's enough. That's enough. Why enough? 20 questions. No, we'll take another 2 or 3. So till now I have given how many? 8. 2 more we'll take. Ninth one. Ninth one. $250 mg. Good. You're doing good. You're playing a game here. OET is a game. OET is a game. If you practice, you will crack OET. Otherwise, OET will crack you. Okay. Next, 10th one. 10th one. Jewelry. Jewelry. Wow. Wonderful. Jewelry is related to what? Is it related to types? Or is it related to simple management for ordinary fractures? Or is it related to dosages? Or is it related to serious fractures? Decide. Amrita, you have to work a little bit harder, Amrita. You are giving too many mistakes, Amrita. I'm sorry, but don't worry. You are my guest, so I am respecting you and I'm going through your answers also. 2, 3 times you made mistakes, so you have to be a little cautious. Okay, because you are a newcomer, na? You don't know our techniques, so that's why maybe. No problem, no problem. These are all regular students, paid students who have registered the course with us. Okay. So they are attending regularly so they can answer very fast. Rajeshwari, what technical error? I don't know. Okay, fine, leave it. So that's it. Right. Are you all ready? How many of you are ready for the test now? Without reading. Okay. Ready? Yes or no? Type. If you are ready, type yes or no. I'll have a cup of coffee now. Will help me? Thank you, dear. You're so sweet. Yes. Yeah. On your march. I'll not give you the answers. No worry, no worry. I'll not give the answers right away. On your march. Now, before we start the session, I want you to invite some more friends who are really, really serious. Tell them how the session is and call them. Now, when they come, their score and your score, you compare the difference, you will know what Simon sir made for you and what they made for themselves. Invite your friends, please. I'm giving you 3 minutes. Bring as many friends as possible in order to prove that you are getting wonderful scores. Okay? They will not get these many scores because they don't get the paragraph. Okay? You also don't get the paragraph. Right? Invite your friends. Today is a demo session. And from tomorrow onwards, no reading sessions free. Only for regular students. So this is the last day for free sessions. So you can invite as many friends as possible. Because next Monday we are taking some more students, 4 nurses and 3 doctors. Last week I wanted to take after the exam, but I was busy, so I did not take. So I'm taking the admissions there. Yeah. So you can invite your friends. I'm also inviting some of the students. How many of you get 20 out of 20 we have to see today? Right. You can just invite friends. You can send to your groups, colleagues, friends. The main show is yet to start. We will not read anything. Don't expect that I'm going to show you the passages. Yes, first 7 questions. Carlyle, you said what? First 7 questions I'll do in the last set. Don't be afraid now onwards. No need to be afraid from now on, because Grand Master class is your strength. Tomorrow onwards, you can proudly say, okay? Tomorrow onwards, you can proudly tell, okay? That we have a different set of training sessions. We have Grand Master class. We have Simon Sir. That's what you will vouchsafe. You will pass the information to your friends. Yeah. Ready? This is the first question. Procedures for delivering pain relief. Procedures for delivering pain relief. Don't write the answer, please. Nobody should submit the answer, please. When I count down from 7 to 0, then I'll say submit. That time you have to submit. Until then, you can study the question. Only the central part, only this white part. Okay, I'll do one thing. Format, background, color, yeah, apply for all. Yeah, now it is easy for you to see only the white color. Yeah, focus only on the white color area, and every other option is there in your mind. All the options are there on your mind. Don't submit the answer. If anybody submits the answer, remove. I'll delete them. One time I'll see, second time I'll see, third time I'll remove from the chat. Okay. Yes. So procedures for delivering pain relief. Classification, management, medications, plaster plaster. 7, 6, 5, 4, 3, 2, 1, and submit. No lazy people. All are dynamic. So 12 students have given the answer. Yeah. Now let us check regarding our answer. Okay. So in which text can you find information about procedures for delivering pain relief? Classification or management or medications or plaster backslab? Okay. Yeah, we are going to start from here. So print a screen. And can you switch on the light, please? I cannot see here. Print a screen is here. Yeah. Yeah. Let them both them be there. No problem. Okay, it's okay. Let it be. Yes. Now, yeah. So here is our Telegram channel. Here you will know our answers, whether they are right or wrong. So this is the first question. Yeah. So this is question number rapid fire 1. This is called rapid fire. Rapid fire round bullet 1. 001. Rapid fire round. Okay. Bullet number 1. First bullet is hit. That's it. Now what you have to do is, below this one I'll give you the options now. Okay. So first answer. Where are these? Okay. Fractures. Okay. Dislocations and sprains. Okay. See. This lecture was given on July 29, 2021. This is the video. Okay. This is different. Yeah. Oh. So that's it. So here it is. Forward. Yeah. These are the 4 things you have to see. These are the 4 things you have to see. These are short answer questions. Okay. So like this. Classification, management, medication, plaster backslab. This is 8th question onwards. Then where is 1 to 7? 1 to 7 here. Yeah. Sorry for that. Multiple choice questions. First one is multiple choice questions. Yeah, here are these things. Okay. Multiple choice questions. So here it is. So, procedures for delivering pain relief. Right. Now, yeah. Multiple choice questions. You can check your answer here for this question. Number 1. Question number 1. I'll take it forward again. Okay, question number 1. To avoid confusion. Now, here. So this one. Yes. Go here. Copy post link. Very good. Very good. Very good. Lovely participation. Go there. Telegram channel. Yeah. Go there to the Telegram channel. I have given you the link. Click on that link. You will come here. and below you will have ABCD. Below you have ABCD, and then, yeah. Yes. Copy message link. Yes. Yeah. So there you see. In which text can you find information about procedures for delivering pain relief? Classification, management, medications, plaster bags. Yeah. Okay. That's it. So below that one, you have the answer. Click on this one, A, B, C, D. Whatever you have done, you can click there. Yeah. You have to click on A or B or C or D here. Now, if your answer is right, don't write here answer Mansi. Now, finished there. They are finished already. We have finished. Okay. Now, update your score. Update your scores. If you got right answer, you update one by one. If you got wrong answer, update 0 by 1. Come on, come on, come on, come on. Go check your answers. Go check your answers here. Okay. The link is here. Copy, post link. The link is here. Go there and click ABCD here. Okay. Go there and click ABCD there. Yes. Right. First answer is done. Now we are going to the second answer. You see, right means it will say right and give green. If it is wrong, it will say wrong and give red. And it will show the right answer afterwards. Very good. So now we are moving to the second question. Second question is here. We don't want paragraph. We don't want to read anything. Trust me. Yeah. You have to change your opinion regarding part A. Yes. Now the second question is here. This is the second question. Don't write anything now. I will count down. Then you have to tell. Just read. The procedure to follow when splinting a fractured limb. The procedure to follow when splinting a fractured limb. The procedure to follow when splinting a fractured limb. Okay. Function. Yeah. The procedure to follow. Okay. Rapid fire round bullet 2. Yeah. The procedure to follow when splinting a fractured limb. The procedure to follow yes. So the procedure to follow while splinting a fractured limb. Yes. 7, 6, 5, 4, 3, 2, 1 and submit. There should be thrill in the game. If you want to defeat, you have to be warriors. For war is a thrill. You don't know from where what bullet will come. So you have to be ready for anything. Okay. So Now, I have already given the answer there. You can go there and check. Now here, copy post link in the Telegram channel, and then copy message link, first or second, anyone you can take. You can go there, you can check your answer. You'll get here like this, A, B, C, D. For example, if you write, then you'll get green color and flowers will fall on you. Celebration. Okay. If you write wrong, it will show red like this, and it will show what is right here. Okay. Yeah. Update your scores now. Update your scores 2 by 2, 1 by 2, 0 by 2. 2 by 2, 1 by 2, 0 by 2. Yes. Which crazy fellow will tell you to read all paragraphs? Why? See the results, see the marks, see the scores. Kalai Chelvi, I want you to open your mic and speak something now. You told me na, that you will wait till the last. Do you need to wait till the last? Tell me, Kalai. You can come on. You can switch on the video also. I want you, the world to see you now, to talk. Okay, 1 second. Where is this, Kalai? Yeah. Yes. Yes, Kalai. You have time now. Come on. 2 answers you have given. A smile is there. Wonderful smile. Okay. Yes. Your time starts now. 1 minute I am giving you. Speak whatever you want.
That's previously I don't know, sir, how to do the reading para A. So on my own, I practice like that because I go through the whole para. So it took some time. That's why I did the last 13 then initially, then go to the first one. But now I feel it's easy to do without even reading the full para. We can got 20 out of 20.
You understood now?
Yes.
Yes. This is Dr. Kalai Chelvi from Sri Lanka. She is preparing for medicine profession, medicine specific profession, and that is her words. Those are her words. Okay, fine. So now, shall we test more? Shall we continue? Yeah. Shall we continue? Yes. We are moving forward. Yeah. Now that is second. Somebody new joined. Rajya Lakshmi Mallela. Okay. Right. So, fine. Next, we are moving to question number 3 now. This is question number 2. What to record when assessing a patient? What to record when assessing a patient? The word, identify the word which will help you with the answer. What to record when assessing a patient? Assessing a patient. This is question number 3. Question number 3. Rapid fire round bullet 3. I'm just giving you some time to think, that's all. Yeah. 7, 6, 5, 4, 3, 2, 1. Submit. Yeah. So 9 students have given the answer. What about the rest? War is one-sided. Wow. Masters, you are doing a miracle. Wonderful. It's not an ordinary task what you are doing. Now you will go to the Telegram channel and you will just check your score. Whatever you have put there, same to same you put. Don't change. Copy, post a link, and then copy message link. Go there. Below this question number 3, you will have options A, B, C here. Okay. You click there and then update. Let's go update your scores. Grandmaster class. This is Grandmaster class. Be proud to tell that you are a student of Grandmaster class. Avil 2 by 3. College Simyat 3 by 3. College LV 3 by 3. Rabil. Yes, from Pakistan. Or Egypt. Yeah. Rajya Lakshmi 3 by 3. Sukhvinder 3 by 3. Matsepo 3 by 3. Amruta 3 by 3. Mansi 2 by 3. What about the rest? Yeah, good. Srija 3 by 3. Shakar 3 by 3. Rajeshwari 3 by 3. Good, good, good. Yes. Sakirat Omobola. Sakira, you are from Nigeria. Okay. Or Ghana. Nigeria, suppose. Okay. Right. So, next. Moving on to question number 4. Moving to question number 4. Don't write the answer immediately. Think. Think. There is one word. There is one word. There is one word. Okay. There is one word. Not one word. 3 words are there. Any word will help you. Terms, different types. 3 words are the very easy answer. Very easy answer. Very, very easy answer. Rapid fire round bullet 4. Yes, rapid round fire bullet 4. Yes, 7, 6, 5, 4, 3, 2, 1, and submit. Yes. 10 students have given the answers. Wow, war, one-sided. War is one-sided. Awesome. Awesome. You are my students. I'm proud to say that you are my students. Grandmaster is at work. Stay calm and learn. Grandmaster is at work. Stay calm and learn. Copy post link and copy message link. Go there and tick on the answer. A, B, C, D, whatever you think, and update your scores. Right. Next one. Question number 5. Question number. There is one particular word which will give you the answer. One particular word which will give you the answer. Think about it. Do not be in a hurry. Think and analyze why it is right, why it is not right. Okay? There's a particular word which is going to help you there. Rapid fire round, bullet number 5. There you go. Yes. The practitioners who administer analgesia. 7, 6, 5, 4, 3, 2, 1. Submit. Wow. Very fast. Very fast. Jet speed. 13 out of 15. So 1 is mine. Okay. 14. Awesome. 100% participation. Yes. I appreciate. Copy post link. War one-sided. Victory is Grandmaster class. Students. OET is going to be defeated. OET is going to be defeated. Every time OET wins with the students, but students are going to win over OET. Okay. The next, copy message link. Go and tick your answer there. So below that one, there will be A, B, C, D. So tick your answers there. Please participate so that there are many other tests in the group. Rajyam means kingdom. 5 out of 5. Wow, wonderful. Do you know the difference? We don't do anything. Everything my students do here. I only start, put fire and you will explode. Only starting fire is Simon Says. Remaining everything, you will explode there. That's it. Next. Yeah. Question number 5 done. Question number 6. Question number 6. What to look for? What to look for when checking an injury? What to look for when checking an injury? Rapid fire round, bullet number 6. Yes, what to look for when checking an injury? 7, 6, 5, 4, 3, 2, 1, and submit. Yeah. So copy post link. Pick your answer. Copy message link. Update scores, please. Did your scores, please. Mansi, how can you get 6 out of 4? It is 4 by 6, Mansi. You have to write 4 by 6. Yeah, very good. Sukha. Sukhwinder Kaur. How did you get 6 out of 6, Sukhwinder? It's a very big question for me. $1 million question for me. How did you get 6 out of 6? Very good. New student. Okay. Right. Next. Last question. Question number 7. How fractures can be caused? How fractures can be caused? How fractures can be caused? Okay. Where will you find this? Is it in classification? Is it in management? Is it in medications? Or is it in plaster backslap? Think, think, think before you think. Think. Rapid fire round bullet 7. Last question. Rapid fire round bullet 7. Last question. Yes. 7, 6, 5, 4, 3, 2, 1. Submit. Yes. Yeah. Copy post link. Wow, war one-sided. Hats off. You are miracle children. You are. Your work is miraculous. Awesome. I don't have a word to say about your performance. I do not have a word to say about your performance. So that is the question. That's the link. Yes. Go there and check and update your scores. Update your scores. Rajya Lakshmi, 7 out of 7. Avil Narona, 6 out of 7. Amruta, Mata Amrutanandamai, 7 out of 7. Sorry. Rajya Lakshmi, 7 by 7. Simyat Abdul Rahim, 6 out of 7. Sakar, 6 and 7 by 7. Sukhwinder Kaur, 7 by 7. Matsapo Lehlo Nalo, 7 by 7. Mansi Dukande, 5 by 7. Rajeshwari Ram, 6 by 7. Okay, technical error is this. Okay. Then Srija Ravindran. 7 by 7. Yes, now you have the chance to speak. Now you have the chance to speak. Yes, whoever wants to speak, okay, you can speak. I am giving a chance for everyone to unmute, but don't unmute until I tell you. Yeah. How many marks did this girl, Kalai? How many marks you got, Kalai? From nowhere to everywhere. Let us start with Kalai, Dr. Kalai. Yes. Kalai Chelvi, you can start your video. Now you give your testimony. I don't know, sir. I will take the first 7 questions in the last, sir. From there to here. Come on. See the full of smiles, beaming with smiles. Come on.
Today only I got to know the techniques, sir. So now I can do from 1 to 20 correctly.
So now you understand remaining questions also will be very easy because you know now what. Actually, this is the way how you have to do. Because of this,
Yes.
they will be easy. So next step you can do. Remaining questions also you should do like this. Then you should go and find the answer. Remaining questions also you have to do in the same way. Then you have to go and find the answer. So next, very good. Thank you, Kalai. Next, who else want to speak? Or if you cannot speak, you can even type your, okay, give your feedback. Give your feedback. Those whom I trust that they will answer, then only I will call. Otherwise, you should message me, then I'll call you. Sukhwinder. Hello, Sukhwinder. Come on, unmute and start your video and here share your testimony. How many marks did Sukh get? 7 out of 7. Very good. Come on, Sukh. Yes, start
Yes,
your video. Yes, come on, share your testimony. How you got 7 out of 7? Wow. Come on, share. Give me some information. I will also go to that teacher and study. Come on.
yes. Sir, now I got 7 out of 7 first time because before that I achieved only 4, 5, or 6. Never achieved 7 out of 7. But now, after attending your lecture, today's lecture, I achieved 7 out of 7 because you give us a lot of strategies to do that how we gained a 7 out of 7 um, and this but first but before attending your lecture I did I started my question from 8th because I have a thought that I don't get the idea that from which text this question is, but now after attending your lecture I got the idea that how I attempt these 7 questions, and now I got 7 out of 7.
Did you read the paragraphs every question or no need to read the paragraph?
Yes, before your lecture, uh, mostly I read every paragraph, but now you give the tricks that how to do. what is the what is the most important things to do to attempt these 7 questions, that there is
Not only
nothing to
these 7, you are mistaken. Not only these 7,
all
all
the
the
questions
20
of
questions, this is very, very
yes,
important.
all the questions of the part A, but we did seventh question 7 questions, so I just focus on this 7 question. But
Yeah,
after attending your lecture, we get the tips and tricks of part A and B, C also.
right. Very good. Very good. Next, uh, who else? Who else want to share your experience? Kiran Kaur. Kiran Kaur. Kiran Kaur. Kiran, are you free? Are you busy? You can message if you cannot, okay? All of you share your feedback. Please share your feedback. Yeah. First time I came to know about these excellent techniques. Not this excellent techniques, these excellent techniques, plural, techniques, plural. So these. Srija, do you want to share? Come on, unmute if you can. Okay, you can share. Rajya Lakshmi, I don't know who will share. So just I'm asking everyone. Don't think I'm not asking you afterwards. It's okay, no problem, Srija. Yeah, next, Kiran, Rajya Lakshmi. Yeah, Mansi says I want to share. Yeah, Mansi, Mansi Dukande. Mansi Dukande got special drive. Okay, can you? Is it possible
Hello,
for
sir.
you
Good
to
evening.
share your video? Can you share your video? Yes, very good. Because your words people will hear, so they should know who is
Sir,
talking.
actually, I have given previously 3 time OET, but I was not able to crack this ABCD. There only I was losing marks. But today's lecture, when you are, means I have not attended previous lectures of yours because of some problem. But when you are, I think so, third question was going on and you are explaining correctly, like you have to mark the word like assessing. That time I understand, okay, assessment means I have to give answer management, means that one word itself gave me clear idea that I have to focus on this. So this is something very nice to understand me to how to answer questions.
Okay, one question I'll ask you. Is this technique which I'm teaching new to you?
Uh, yes.
No, it is not. I'll tell you.
Yeah,
I'll
it
give you
is
an
new
example.
because
No, I will tell you it is not new. I'm proving it that it is not. For example,
okay.
for example, if I have pain here, if I have pain
Okay.
here, you will apply
Huh.
balm to the full body or only here.
Only on shoulder
That
where
is
I
what
have
it is.
pain.
That's what you have proved that what I am telling you already know.
Yes.
If you apply balm to the entire body, that means you don't know where to apply balm. You know where to apply balm. Here also this pain is there. Pain is the problem. Balm
Yes.
is the solution. You understand?
Yes.
Study is relative. Study is relative. Pain is the problem. Balm is the solution. If you can apply balm to the pain exactly at that particular location, here also you can give the solution to the problem at the exact location. You can identify that. That's it. So simple as
But
that. Same thing. This is life. Life is same. Only the thing is you have to realize the connection between different things. That's all. Okay, fine. Right. Next.
thank you, sir.
Avil, do you want to share anything? I will never know.
Actually, I was struggling in reading part A and all reading parts. So now I'm able to get without reading the text, all text, without only reading with questions. So I'm getting scores. So I got 6 by 7. One question I missed. So yeah, I was not expecting. I told you before. Yes.
Right. Thank you very much. Right. Thank you very much. Yeah, all of you can share your problems. You can share your points, what you feel about these techniques, and you can discuss these things. This is the first round of 6 sections. First round it is. Then anybody else? Simiat. Simiat is there? Yeah. Simiat Abdurrahim. Yeah, you can unmute and you can share your experience. If you are comfortable, you can start your video. Otherwise, no problem. Yeah. Share your experience.
Hello. Yes, actually I'm excited that at least it shows a green light, because initially if I'm practicing, I normally leave the 1 to 7 to do at last at the end of the reading part A, because I believe by then I would have known, I would have read into all the sections. I normally read, I will skim and scan the sections, read A, B, C, and D. So by then, I would have believed that I know what the passage is all about. So, but with this, which I'm not actually fast. So, and the main thing about OET is speed and accuracy. So if you are not fast, even if you know it, you won't be able to meet up with the time. But with this method, I find it very useful and impactful. So I really appreciate.
Thank you very much. Yeah, that's Simiat Abdurrahim from Nigeria. Yes. So there is one more, Ifat Jabin, regularly attending, but I think today you started late. So you missed the session, I think. Just now you joined, I feel. Yeah. Anybody else you want to speak? Vinita, do you want to share anything? Vinita, Shakar. Hello, Shakar. You want to share? Amrita. Amrita. Amrita got 7 out of 7. Initially, she was doing some mistakes, but afterwards she recovered and she got 7 out of 7. Yeah, Amrita, do you want to share your experience? Right. So this is Grandmaster class, and I am Peter Simon with you. We have done with the first round of part A. We're going to do 3 rounds of part A. Part A is gear 1. If this 1 to 7 questions only, if you cannot understand, then 8 to 15, it will be very difficult. And 16 to 20 will be the most difficult. Because this is, if you know how to ride a motorbike or drive a car, then you will know what are called gears. Gears. First gear is 1 to 7 questions. Second gear is 8 to 15 questions. Third gear is 16 to 20 questions. If you cannot control gear 1, then gear 2 you cannot control, and gear 3 you will definitely make an accident. So that's without first gear, how can you go for second gear? That's my big question. Okay. And without second, how can you go for third gear? So first 7 questions are difficult questions. Second set of 7 questions are more difficult questions. And the last set of 5 to 6 questions, the most difficult questions. That's it. I'm not joking. You know, you understood now. Maybe when I said, I'll ask you one big question now. I told you in the beginning, I told you, okay, in the beginning. What did I tell you in the beginning? That you can answer the questions 1 to 7 without actually reading anything. That time, when I said in the beginning, did you believe me? Did you believe me 100%? 100%. Not even 99%. 100%. Did you believe me? Say yes or no. 100% if you believe, then you say yes. Beginning. How is that possible? How is that possible? You may be thinking, you trust Simon, sir. But did you believe that you can learn? Okay, that time 100%. Then now how much percent? After my explanation, that's what I'm asking. Now, can you tell your friends the same thing which I told you? Now, can you tell your friends the same thing which I told you? That you can answer the first 7 questions without actually reading anything. Okay. The technique is called not reading, it is studying. Studying. Experts, ordinary people do reading. Ordinary people do reading. But extraordinary people do studying. So they are experts. Okay, right. If you have that expertise, then you are experts. Do you agree or disagree? Do you agree or disagree? This is my last question for today because I'm going for lunch, dinner. I'm going for dinner. Yes, those who are watching on the YouTube and those who are watching on Zoom, if at all you are interested, in learning on a regular, today's is the last session. Today's is the last free open session. So for the next 1 month, you will not have reading sessions free because we are recruiting students. So those who are interested, you can contact me, and my number is plus 919877867360. This is my number, and this is my WhatsApp number. 98778. Yes, Shakar.
I'm sorry, I've been away since I just came back.
Yes, tell me, please.
I've been away, so I don't know what's going on anymore. I'm sorry.
Yeah, the session is completed, and I'm just giving the contact number for the students
Okay.
who are interested to join the regular classes. That's what is going on now.
Okay.
Yeah.
Okay, where's the number?
Yes. Okay. So, right. So, those who are interested can contact me on this number. This
Okay.
is WhatsApp number, and I'll respond to you. There are 4 places for nurses and 3 places for doctors. 4 places for nurses and 3 places for doctors. Altogether, 7 places. So those who are interested, you can respond. Thank you all once again. Thank you all for making this session a wonderful session. See you all in the next session. Maybe after my dinner, I'll send a link. If you are available, you can join. Otherwise, if I don't send, we'll meet tomorrow. Yes. Good night. God bless you. Invite your friends to attend these sessions. Maybe, who knows, they want to join the classes and they can learn. You can invite them. Yeah, that's all for now. Good night. Yeah.